Thank you so much for being with us today, William. We're at the Center for Device Innovation at Texas Medical Center, and I can't thank you enough for your time. Before we get started, would you mind introducing yourself briefly and your role with CorInnova?
Sure. My name is William Altman, and I'm a CEO of CorInnova. My background is I had an electrical engineering degree undergraduate and got an MBA at Harvard. I briefly went into McKinsey & Company for management consulting and did some private equity investing, and then have segued in the last 20 years into doing basically entrepreneurship and doing medical device and medical startups.
Perfect, thank you. You touched a little bit on your education, and I think that's really interesting that you had different avenues or facets, which really I feel like complement our industry very well.
Yeah, exactly. It's been a great preparation across different industries, different disciplines, and having been a private equity investor, I know what investors are looking for, and then, and having done consulting in large companies, I've seen what it takes to build teams. And I think one of the great things we've done with this company is not only marry a great technology, but we've also been able to recruit a fantastic team of advisors that are world-class and world-renowned. So we have, I think, a really good team for developing this technology, including like the former Chief Regulatory Officer of Medtronic, Susan Alpert, some other people that are really well-known in the field.
So you're very supported.
We are very supported. In fact, that's been very nice to see how supportive the cardiology community has been for our device. And there's probably 1 million people that need a heart transplant or some type of cardiac assist, but only about 4,500 heart transplants are given a year, and about 10,000 people are eligible to use the existing devices because they're so invasive and they touch the blood. And we have a device that's so much easier to implant and so much more gentle on the body that the cardiology community really thinks our device has applicability to, 5 to 10 times as many patients as existing devices. So it's been nice to sort of have the support of the community as we go forward.
Let's dig into the company a little bit. So what is the story behind CorInnova?
Well, CorInnova was founded by a full-time professor at Texas A&M, Professor John Crissione, who's a brilliant person. He's not only a brilliant biomedical engineer, but he was also actually trained as a physician, but chose not to pursue becoming a physician, but instead to be an engineer who could bring innovations to doctors. He realized and did some research that found that a lot of people that have heart attacks have a big section of the heart damaged. And so after the heart attack, they develop heart failure because when the heart's trying to pump, the dead section of the heart or damaged section bulges outward, and the heart starts moving erratically, and then so the body compensates by making the heart bigger and bigger and bigger. But that's what leads to heart failure, and in turn that leads to decreased pumping of blood in the body. And then you feel exhausted because you can't get enough blood to pump, you can't do anything, and you go from being a very healthy person and perhaps even only 4 or 5 months later after a massive heart attack to have heart failure and perhaps have a 50% chance of dying within 2 years. So he thought, these cells, there must be something that drives the growth and remodeling, and it seems as though this bad motion leads to cytokine signaling that's telling the body to get bigger. So if I could just create a device that created good motion and kept that wall from bulging outward, maybe I could convince the heart not to grow and remodel, but I could stabilize the heart until that dead tissue formed a scar, take the device off, and then the heart is in its proper shape, and then it will pump in the proper shape. Fortunately, the American Heart Association gave him $250,000 for research. He started the research and then got a follow-on investment of $1 million from the NIH, and over a 4-year period, along with another $500,000 from the state of Texas, did a number of animal studies, did a lot of engineering work with the help of Dr. Christina Bolch, who you'll talk to in a few minutes, and was able to go through multiple iterations, and from a vague idea was able to come up with a very practical, very minimally invasive way to implant such a device around the heart and then to gently squeeze the heart to give it both correct motion and increased output. He came up with a way to make this device not only to fit inside the pericardial sac and only be a few millimeters deep, but also he figured out a way to fold it down in a 1-inch tube so you can implant it using a left thoracotomy by separating 2 ribs, putting the tube up close to the heart, make a small incision in the pericardial sac, and literally in about 10 to 20 seconds the device slips over the heart, it fits itself there, you take the tube out, you can adjust it, and with a 30 or 45-minute surgery you've got this device around your heart that can increase your output in a gentle way without touching blood. Whereas the existing devices require 4 to 6 hour surgery and a 30-day length of stay in the hospital.
Well, the technology is extremely disruptive from what I'm understanding. It's displacing the way that we ever looked at heart failure. So is that what made you want to join CorInnova as the CEO and lead the company to more success?
No, that's a very good point. At business school, one of the things they taught us is always, don't just think something's going to work. You should go ask the customer if they even want it. So I insisted when I talked to Dr. Christian that I wanted to talk to the clinicians that were advising him on the project and to work with him. So when I went to visit two clinicians at the University of Southwestern in Dallas, who were top people in the heart failure area there and in surgery, I asked them, I said, well, what do you think? I mean, would you use it? They said, we love this device. They said, even if it doesn't prevent heart failure, the fact it doesn't touch the blood is such a breakthrough, because right now we spend all our time with these people that have artificial hearts or LVADs. We spend all our time managing the complications of blood contact. So anyway, so that's why I got involved, because the doctors told me they would use it.
Well, that's very special and exciting. So let's talk about milestones. What's the most recent milestone that CorInnova achieved?
Well, we've completed a series of 9 animal studies at Texas Heart Institute, working with Dr. Billy Cohn, who's head of this great Center for Device Innovation here, and he's a great advisor to us. So far, we've done about 40-plus deployments of the device in various studies, and it's a 100% success rate, and we found we could increase the cardiac output 30 to 40%. And so our next step is to move from this first series of studies in a ESMO model heart failure, which I won't go into details, but it's not the best model, to a true disease model of heart failure, where we actually induce heart disease in an animal by occluding the vessels of the heart and making the heart actually get big and enlarged. And that'll give us even better data, and we hope to see even better increases in output once we move to that model.
Congratulations on the milestone. What milestone will make you feel like you finally made it?
Well, we have, we like to see this used in the clinic, but before we get to the clinic, the next most important milestone is to get to our first in-human study and actually get first data in humans that this device works and works safely, that we can show that it's planted minimally invasively, that it goes in quickly, that it doesn't have any harm to the patient, that it does increase cardiac output. So we plan to do our final set of animal safety studies in the next 6 to 9 months, and then basically remanufacture the device for human heart size in 2020, do 6 patients, first in humans. So we get to that point, I'm going to be very excited, because I know that we have a lot of medical device companies that are looking at this, and once we get that type of data, I know that we'll be able to get a good group of folks together to put the money in to bring this to the market.
There's no doubt you're going to be hugely successful. You already are. There's an unmet clinical need, and the clinicians want it. So I'm going to keep track of what you're doing, and I can't wait. Any last thoughts before I meet your associate, Dr. Christina Bolch?
Well, I guess the final thing I have to say is I think that this is truly a transformative technology. I mean, this technology has the potential to be as common as pacemaker technology.
Wish you the best of luck. Thank you so much for being here, William. And now I'm going to meet Dr. Christina Bolch. Thank you.
Thank you.
Dr. Christina Bolch, really appreciate you joining William today. We are at CDI at TMC, and I want to get to know you a little bit better. Would you mind introducing yourself and your role with CorInnova?
Sure. So my name is Dr. Christina Bolch, and I'm the Senior Biomedical Engineer at CorInnova. I actually started off as an intern in undergrad in 2007 in the lab of Dr. John Christian, who is the inventor of the technology and the founder of CorInnova. And I enjoyed my work so much during that internship that I stayed on with him and got my master's degree and a PhD in his laboratory, cardiac mechanics laboratory at Texas A&M, and then was fortunate enough when I graduated in 2012 to stay on full time.
Well, I can't wait to dig into that more. So let's take it back to your early days. When did you develop your interest in engineering? Was it an early age, or did something happen in your life that led you this direction?
So I think that my exposure to technology probably came from my grandparents. Both of my grandparents actually worked for NASA for quite a while. My grandma in the 40s actually got her master's in mathematics, which was a pretty unique thing at the time, and was a human computer. She did flight analyst work at NASA. My grandpa was an aeronautical engineer, and he was actually head of mission planning during the space flight era. And so just growing up around that, I think, I was introduced to technology and mathematics and engineering and how like exciting and what kind of changes those could make in the world at an early age. And I've just always been really interested in life science. So I think biomedical engineering was just sort of a perfect fit for me.
Sounds like your grandparents fostered an environment for success and interest in technology, and I love that you were able to marry that inspiration to your interests.
Right, and then I actually became interested in the cardiovascular space specifically because we have a history of heart disease on both sides of my family. So, I felt that there was an unmet need in that area that could be worked on.
Well, necessity is the mother of innovation, so I could not agree with that more.
Right.
You kind of gave us a little idea of how you got involved with technology. Did you have any inspiration in your early career?
Right, yeah, so Dr. Christione, like I said, the inventor of the technology, has greatly impacted my career, obviously. I've been working with him now for 11 years, and we literally started working out of a garage. We made prototypes out of materials that we bought at the grocery store and at the craft store. Pulled all-nighters, trying to make these things and test them in animals, to where now we've got a medical device manufacturer that we're working with who produces these devices out of biocompatible materials. And so now we're doing a lot of preclinical work and testing, and are excited to take this to the next stage.
Fantastic. So am I understanding that you've been involved with the device very specifically in a way that you're tweaking the device or creating different iterations of the device?
Correct, yes, yeah. A lot of iterations, hundreds and hundreds of iterations over the years. We would go through multiple iterations and designs on a daily basis. We started learning not to plan ahead and make extra components because we knew that they would be obsolete by the next day. As soon as he saw what we had done and he would want to make changes to the design, or we didn't like the way that one particular thing was working. And so everything was changing very, very quickly.
I can imagine. This is a perfect segue. Could you go into the product or your device a little bit more? Tell us a little bit about it.
Sure. So our device is a cardiac assist device. But what makes our device special is that current devices on the market actually contact the blood and are very invasive to the patient to implant. So our device actually is situated around the ventricles of the heart within the pericardial space, and we read an ECG off the surface of the heart, and then we cycle air in and out of these polyurethane chambers that are around the heart. And in doing so, we increase cardiac output in rhythm with the native heartbeat. And the other interesting aspect of our device is that it is collapsible. We can collapse it down into a less than 1 inch diameter tube. And then once the surgeon gains access to the pericardial space, which would be through a 1 to 2 inch incision in the left side of the ribs, once they gain access to the heart, the deployment typically takes less than 20 seconds to implant, and it requires nothing more than the tube and the device.
Wow, Christina, I'm going to be honest with you. I got to see it to believe it. Do you happen to have the
Well, we can
device?
make that happen.
Excellent. If we could take a little bit, and if you can show us a little demo.
Okay. So here's the device. These are the polyurethane air chambers, and as you can see, it inflates with air as the heart contracts, and then it deflates as the heart relaxes. So if you can see that. And that pumping action increases cardiac output. And then, as you can see, once it's deflated, it's very highly collapsible. This frame is made out of shape memory wire. So it goes back to its original shape. That's how we achieve the minimally invasive implantation method.
Well, thank you, Christina, for showing that to us. I wish you the best, Christina.
Thank
and William,
you.
thank you for being here. Best of luck.
Thank you.
Thank you.